Good afternoon. Warm welcome to you all to Mindscapes 2022 markets. Havish M. Consulting, kindly explore the electric event by MAXI XLRI Delhi. So the Marketing Association of XLRI or MAXI was founded in 1971, and for almost half a century we have functioned with one simple objective in mind: to popularize the field of marketing in XLRI by making it something not to be just studied from thick textbooks and lengthy case lists, but something to be experienced hands-on through interaction with companies, analysts, and the common man. MAXI Fair, which celebrated its 42nd anniversary last year, is India's largest disguised marketing research event. The Brooke tea packs, Bubble Wicks, and Pepsi packaging that you see in your local store daily are the products of MAXI Fair. With Mindscapes, we are taking this legacy forward, and we aim to establish a unique industry forum that brings together industry stalwarts to discuss the impact of pandemic on healthcare and healthcare adjacent sectors. This discussion will be followed by incorporating some fresh ideas from students' perspective, wherein participants from our national level case competitions get the chance to present their solutions on industry problems to our esteemed judges. We, MAXI at XLRI Delhi, are looking forward to an enriching discussion. Without any further ado, we would like to introduce our panelists time out of their busy schedules to attend this evening.
The first panelist I would like to introduce is Mr. Manas Mishra. He is an alumnus of XLRI Jamshedpur from the batch of 1989 and has had a diverse range of experiences across banking, insurance, 2 years in diverse sectors such as treasury, banking and trade services, e-commerce, retail banking, and also 2008 until 2011. He also has 5 years of experience in the insurance sector, having worked in Canada HSBC, Oriental Bank of Commerce, Max Bupa for 3 years, where he held the role of the Chief Executive Officer, and has also held the role of Managing Director of We Health by ITA India. Since 2020, Mr. Mishra has been working. Doc Online is a leading telemedicine and digital primary healthcare provider founded in 2016 that provides a comprehensive range of healthcare services such as doctor consultations and corporations. I would like to invite sir to say a few words, please. I'm sorry, sir, you're on mute.
Yeah, thanks, thanks, Sonia, for that welcome. I'm delighted to be here in XLRI. Virtually, not actually in person, but I hope you will invite me in person as well. I'd love to go back. I myself have been an active part of MAXI when I was on campus. Marketing fair was the highlight of both junior year and senior year. So yes, it's exciting to be finally called in as an external expert. But I'm sure each one of you are experts in inviting me.
It's our pleasure, sir. Next, I would like to go on and introduce our next panelist, Mr. Arijit Chaudhary. Mr. Chaudhary has more than 23 years functions such as consulting and commercial functions for large corporations. He is a 1999 alumnus of TA Pi Management Institute, Manipal, and a healthcare company, Sanofi, and also Indian pharmaceutical company Alembic Pharmaceuticals, and has over 11 years of experience at the pharma giant Ranbaxy, where he was the head of the strategic business unit for dermatology and cosmetology. Mr. Arijit also has more than 8 years of experience in IQVIA, the multinational health information technology and clinical research company, where he was the senior director for life sciences, consumer health, and global key account, where he led the commercial operations for the pharma and consumer health verticals of IQVIA. For the past 1 year, Mr. Chaudhary has been the Senior Vice President of the pharmaceutical giant Cipla, one of the largest pharma companies in India that touches the lives of millions of Indians through its offerings of therapeutics across respiratory, oncological, and other conditions such as generic medicines, diagnostic services, and OTC solutions for health and wellness. Would you like to please say a few words, sir?
Thank you, Akshay, for the invite, and it was a pleasure coming back to campus of the sort, because I've always tried to be close to students and campus because it's a great learning center for all of us, who are in the professional side. What we bring on table is more of experience and I will say the softer aspect of business, whereas you guys bring on table much more hard technical expertise. And for my personal self, I'll say that it's a great opportunity to be part with, to be associated with an organization like XLRI, to be part of your marketing excellence program. Looking forward to this interaction with all of you.
Thank you so much, sir. Moving on, I would like to introduce our next panelist, Mr. Somakre. He also is an alumnus of XLRI from the batch of insurance industries, starting with Aviva India, the life insurance company, where he had worked for nearly 2.5 years, and he held the role of the manager of strategic initiatives. For the last 5.5 years, Mr. Ray has been working in Care, which is a healthcare consulting company. Currently, he is the Vice President of Operations, and so basically, Care is a B2B company founded in 2015, and it is a comprehensive online healthcare benefits platform for enterprises, providing services such as telemedicine, pharmacy, mental health, and fitness for employees. Would you please like to say a few words, sir?
Yeah, sure. So, hi guys. Coming back to the Excel Forum always gives me pleasure, right? And it has been an interesting journey post Excel, and I'm sure you guys, with the kind of exposure that you're getting in terms of the industry and in terms of the knowledge, you will be well suited post the course in terms of placements and other stuff. And it brings me lots of pleasure to come back to this forum and be able to address fellow alumni, or to be alumni from the same college.
Once again, I would like to thank all our panelists. So as we are all geared up for the event, we proceed towards the discussion round with you all, and where we will be gaining some insight from your experiences. And I would also like to tell the audience that you are invited to join the discussion by posting the questions over the chat. So we would like to know, what were the most prominent challenges that your company faced during the pandemic, and how did you go about it? So I would like Mr. Mishra to start.
I got to remember to unmute myself each time, right? So, for me it was both personal and as a company, because I joined a new organization on the 1st of March 2020, which was literally 2 weeks before the first crazy lockdown that India saw. And I had been all of 4 days in office when we were locked out. So I think the first challenge was just to maintain operations, to quickly switch to work from home. It's not something we had done before or tested before. So our IT team did a great job in ensuring that there was absolutely no blip in our operations, and we were able to look after our existing patients, existing customers, with everybody working from home. Professionally, that on the personal side also was a big challenge, because I had not met my top team, it was a little bit strange, I guess, because we were still getting used to the idea from work from home. It seems natural today, but just to get to know people, to understand where they're coming from, and just to understand the way the company worked was quite an interesting challenge. In terms of demand, as far as Doc Online is concerned, I'm sure Care, Shomik's Ray experience will be different, because I think they're different, and they're, I think, probably much better than us in many things that they do. But we had a very interesting phenomena where we suddenly had a huge excess capacity of doctors in the first wave of the pandemic. And the reason was that we had a number of doctors employed in our UP government project, where we run these digital primary healthcare centers. And in their wisdom, the government shut these down. And therefore, these doctors had nothing to do. So, and at that time, we didn't have that many large customers, etc. And therefore, we suddenly had a big increase in supply. I think we figured out that we could leverage it because people were desperate for doctors. And here we were. And our model is that our doctors are employed by us. So that is very different from many other telemedicine companies. So, these are all employees. So suddenly you had this sort of surplus doctors when the ecosystem was desperately looking for telemedicine. So we decided that the best thing to do was to offer it free. And therefore, in the first wave, we actually offered our services free and that was done on our website. It was free for retail customers. It was free for corporates. And we also volunteered in a very interesting telemedicine initiative called Step One. And we were one of the first people to volunteer for Step One, which has now become a massive community initiative. And they don't really need our doctors anymore. But in the beginning, we were one of the first people to say, okay, we're going to put dedicated doctors on Step One, which was at that time only for the Karnataka government. And I think what is interesting is the three waves have all been different for us. The second wave, we saw huge demand because by that time we had a much bigger customer base. We had signed up a number of large corporate customers and we saw a crazy amount of demand. The UP project was again closed. But even then, we were certainly short of doctors. And in some cases, we were not able to give appointments on the same day, which I think is not good. And then for the third wave, I think we prepared better. We had much more capacity added, excepting we didn't see that crazy demand in the third wave. So I think we are learning. It's been interesting. But I think throughout, by and large, as far as telemedicine is concerned, I think has had a positive rub-off. But we can come back to that. Actually, this has been positive, although obviously it's a terrible thing in many other ways.
Thank you, sir. So now I would like Mr. Chaudhary to throw some words on the very same tone.
I think in many ways, what Manasa just said was also true for us. But I will put it this way that, perspectives differ from your standpoint, right? So there are, I know many industries face phenomenal challenges, and I'm not, taking that away as such. But, in a pharmaceutical industry, it was very different. In fact, well, I moved to Cipla right at the, right in the start of the second wave. The first wave was I was part of the consulting organization IQVIA. And what we saw during the first wave is that there were a lot of questions that came along from the healthcare stakeholders in trying to understand what ifs, right? What if this happens, what will happen? So there were a lot of questions. So from a consulting world, I would say that there were tremendous inquiries on understanding what are the different possibilities that could take place if things were going one way or the other, right? But the second wave was more about execution. So I will put it this way, the first wave from the pharmaceutical industry was they were in the dark, not prepared, both from capacity, from knowledge, from awareness point of view. Whereas from a consulting point of view, that was an opportunity because we had the knowledge of what's happened in Europe, what happened in Italy. We had a phenomenal consulting team supporting from China in terms of where they went through in the first wave. So that's where it kind of helped from the consulting point of view that we could possibly give a fairly accurate view of what could happen to the healthcare stakeholders if the first wave would hit certain level. And that's what had actually happened in the first wave. Well, I took a decision to move out right when first wave was ebbing up. So, and I thought that is all over. Great to join back the industry, face-to-face people, interaction and everything. Not that I know that while I was shifting, second wave was brewing up. In fact, very interesting on my personal note, on the last day of my previous organization, I actually contracted the disease. The last 2 days, we met a lot of people, shaking hands and giving a hug. I didn't realize that I actually contracted the disease at that point in time because the day I was supposed to join CIPLA, I had very high fever, right? And I just had my vaccination the previous day. So initially I thought it's just a vaccination impact. But it then went up and started shooting up. And then my sons had it. So I guessed that there's something wrong. And I realized that, I was in the midst of a COVID outbreak. And possibly I caught it very early in the second wave, right? But then it kind of managed pretty well. I don't think I had too much of a challenge. But once I entered the organization, it was completely work from home. And I will put it this way, that what I saw in those days from an operation point of view, because people have had the knowledge, knows what could come, it was time for execution. And the execution pace in CIPLA was absolutely phenomenal. The nimbleness in decision making went up by few times, in that organization. Supply chain decisions, stopping a few lines for certain products and prioritizing certain lines because those were the need of the hour, right? I think those decisions happen in hours, which pharma doesn't. Pharma is very, very resistant to some changes. So I think those changes were phenomenal to look at in terms of what happened. The second thing that happened was people realized that you cannot build capabilities in a work from home situation, right? You can only strengthen what you're strong in. So the focus always went back to the strength area. Whatever you're strong in, you go and build it up rather than trying to build new things around in work from home status. So that was the second bit. The third was risk-taking ability. In the second wave, I think the first wave, a lot of companies were taken aback by, they were not sure what to do. But in the second wave, CIPLA took a chance. They decided to tie up with Roche for, the cocktail, the monoclonal antibody. And that took few days to close out, because once there was a massive situation in the ground, there was no choice given to us. Phone calls were made. We involved the government of India to make phone calls to the Roche headquarters to allow certain things to happen. It happened in weeks and things came out. I will still say we still have regrets that we couldn't prevent a lot of things which happened in second wave. And if we could have taken a few decisions a little earlier, maybe a week or so, or maybe 2 weeks earlier, we could have saved thousands and thousands of lives. We did touch a lot of lives during that period. But there's always, the demand was significantly higher than what we could supply. I think last of all, I will say that, what came very obviously, across supply is that your heart was ahead of commerce. Your heart was always ahead of commerce. We stopped a lot of products which were much more profitable, right? And it was a clear instruction given from Dr. Hamid to Umang to everyone that guys prioritize what the country needs, what the society needs. Even if we stand to lose on EBITDA and commerce and stuff, that's fine. But because that goodwill that we generate will have far-reaching effect over the years as compared to the commerce that we could make during those period of times. And there were innumerable examples of how it created an impact. And we are actually, reaping the benefit of that today. When we sit today, after the third wave and everything is over, and possibly every doctor, has a different opinion of CIPLA when they go out, irrespective of the specialty. And I think that is what, that viewpoint of having heart ahead of the head, is what made a difference to the organization. And very few companies can take that call, to be very honest with you. I've worked in many companies, they would not, right? But to do that, to see that effect that could come in the long run is something which was phenomenal.
Thank you so much, sir. So as mentioned that there are different perspectives, everyone has their different experience. So now we would like to know from K, what was the most prominent challenge and how did the company cope up with that?
So if you go back to the first wave, right? The first wave was all about a shock. It was a jolt, right? As everybody mentioned, I don't think the entire country was prepared. And honestly speaking, neither were we, right? So it was war room after war room in terms of managing what was going to be the next direction for the organization. Within days, 3-4 of our service lines got stopped because of COVID restrictions, right? And we had to find a way in which we could engage with the corporate base, and we could also look at what is the future business growth that we can get from that. Within days, for months at end. So we, as a managed marketplace, we do a lot of different kinds of services, right? From dental to vision to gyms. So all of those services went for a immediate scratching point. So we changed the focus of the organization from diagnostics and the ancillary services towards telemed, and working with large-scale partners like Tata 1mg to drive the e-pharmacy modules, which were in demand. Along with that, we realized that people are living a sedentary lifestyle now that they've suddenly gone back to home, right? So we did a lot of engagement, fitness-related activities within the application to drive the benefit, right? And to give that awareness of fitness to the end users while they could be sitting at home and doing what they had to do. Right. This helped us gain a lot of traction in terms of mind space from the clients, and thereby it started the new series of growth expansion for the organization from our telemed, and also the fact that the government actually finally legalized telemedicine or regularized telemedicine. Right, that helped from a long-term perspective in terms of the growth. The second wave, as Mansi said, was more about execution. The market, there was clarity in terms of what was happening in the second wave. There was a structure that we knew what was going to happen. However, the timing was unknown, and the strain on the logistics was unparalleled. I have never seen the kind of logistical failures that were there at that point, right, across multiple partners, multiple service lines, because every second person that you knew was COVID positive. Right. And diagnostics had completely basically shut shop in Mumbai, Delhi, NCR, and right. So the strain on the system was something, I think, that evolved the industry to a large extent in the second wave, right? Which gave us the capacity and the handling power for the third wave in an overall sense, right? So we actually pivoted multiple times. We actually had to pivot and start off newer service lines, newer ways of approaching the same problems while we were going through the first and the second waves. And being a small organization, it is important that and being a venture fund driven organization, it is important to hit the numbers on an ongoing basis and show that growth to the investors. And keeping that in mind, I think the number of pivots that we made from a business model perspective, from bringing in telemed to bringing in home collection as a standardized approach to even looking at dental as a virtual consults. And now things have started being stabilized, wherein the normalcy is coming back to a certain extent. While even for the third wave, if you look at it, the amount of panic, fear that was there in the third wave was less than maybe 5% of what was there in the first two waves. This is because of the awareness and because of the accessibility of healthcare that has improved over the last 2 years. right? And that has been critical. And because of, and if I don't know if the team here is aware, we were involved in as part of the vaccination drive for corporates, and because of that availability of boosters, because of the phenomenal work that the government has done in terms of the vaccine supply, I believe a lot of people are more assured, or rather fearless, I would say, now that they are vaccinated, fully vaccinated, and booster shots have also started happening. So that has also helped in terms of the entire landscape in terms of the healthcare. Of course, there is a long-term impact or a long-term story to it in terms of the healthcare segment, because right now we don't know what is the long-term impact, right? Because today you've been sitting idle, working from home for the last 2 years. So there is a lot that needs to be discovered still, and there is a lot more that we have to work towards in terms of getting all the people back to their healthy lifestyles.
Thank you, sir, for such great insights. So as we were discussing that there was a lot of information scarcity when the pandemic started. So now, after 2 years since we have been in pandemic, there is a lot more information available and a lot more clarity on a lot of fronts. So how do you think that, is there anything that could have been done differently for you or your company if this information was available? So I would like Mr. Arijit to start.
Well, I will put it this way that, especially in the second wave, we did certain changes within the organization to support the second wave. And I put it this way that if we could have estimated those, the impact of second wave a little better, possibly we could have acted a little faster. I remember our capacity for remdesivir went up by 3 times in a matter of 40 days, right? Still, we couldn't support the requirement that the country required. Right? Our respiratory products, especially the inhalers, it came out very, in a British medical journal that your respiratory inhalers are actually preventive in many ways. For complications and stuff. We were not prepared for, our capacities were not ready, because inhalers are not just about the capsules, it's also a device, right? So I don't think we were prepared to scale up to the level which the country required. Even today, if you ask me, we call it pendency, which is how much order we're not able to support. Our pendency is almost equal to the month's sale that we do, for some of our product lines. That's the capacity, that's the far-reaching effect that it has happened. And what Somak was talking about was the long-term challenges. I think these are the long-term challenges which have already started to emerge. And in many ways, our industries are not so, some of the lines are not so equipped to scale up so quickly. That's one aspect. Second, I'll say is that I think, some of the licensing work that we did during those times, tie-up with companies, and whether it was Roche for initially tocilizumab, which is Actemra, then there was initially remdesivir, then there was tocilizumab, then we tied up with monoclonal antibody. Now we have tied up for molnupiravir. I think especially in the second wave, I'll put it this way, I think if we could have estimated the scale of the disease a little better, we could have possibly done a little better job there. We did a phenomenal job, and I think there were a lot of risks that the organization took. There could have been potential write-offs that we have had to, if things, if we went wrong, and those were great things were done. But I think those are the areas where we could do well. The other thing I think I'll also say that we could have done better, is one of the good things that we did is that we tied up with multiple hotels, hospitals across the country. We've almost 40, 50 hotels with blocked rooms because we knew if family was infected or an employee was infected, you need to, quarantine them. And in small homes, it's not possible to quarantine. So across the country, we blocked hotel rooms, and we said that any employee who gets who needs a quarantine, we have hotel tie-ups. You can go and yourself, take care of yourself. But because of our operation always revolved largely around, the tie-up world were largely around the metro class 1, class 2 towns. I'd say a lot of the lower class town field force we couldn't touch in many ways. They were struggled quite a bit. So I think those were the things that we could have done. And today some of those action plans are already worked out, and today we are much well prepared in terms of working those challenges if we were to face that again.
Manasji sir, would you like to add something from Dr. Kandling?
I guess, thanks very much. You always look back over 2 years and see what you could have done differently, what you could have learned. And I'm sure the one thing that sometimes I think about is that, what are the opportunities that we missed? If we had known, or if we knew how bad things were going to be. For example, we launched a very well-priced and very good COVID care at home program. But we never really promoted this to the sort of consumers, where, because we don't have a B2C model. So, there are missed opportunities, and I'm sure there are missed opportunities. So I guess you always look back and think about what strategically could you have made different choices. If you had better information, in hindsight, it all looks easy. So that's one of the issues. I think that there are more, tactical issues as well. How good are we at the capacity planning? Is the model that we use the right one? So you always try and look back and see whether you could have done that better. For example, we did learn and we overcapacitized for the third wave. Turned out to be overcapacity. So I guess you live and learn. And I think that the pandemic has taught us many things. I think at a more human level, I think the kind of panic we saw, as well as the kind of humanity we also saw. We saw both ends of both extremes. And I think being in the healthcare space, that was another thing that was quite something to learn from, is how different people behave. While some people really try and help, there are other people who sort of take advantage of the situation. So I think we've learned from that as well. And that's at a more personal level. So I guess for all of us, I think it's been such a severe impact to normal life that I think we've all learned from it. And I hope as an organization also we've learned a few lessons from the last 2 years.
Thank you, sir. Soumit sir, would you like to add something?
I think, to be very fair, I think Adijit and Asif will also agree. I don't think first wave, the lack of, the clarity or the lack of it was so high, right? That I don't think there is much anybody could have done differently, right? But I think and I see this as a trend across what both the panelists said, right? Is that the second wave is where people always thought that they could do better, they could save more lives, right? And it's an echo of the same thing, right? So as I said, during the second wave, the logistics failed. The logistics failed completely in the diagnostic segment. They started failing in the pharmacy segment, e-pharmacy retail segment, right? And that is where as Manasji exactly said, right, the capacity planning, the scale of it is something that we could have looked at better. We could have planned better. It was always a catch-up game for that 1 month of April to early May, right? And the other thing is, of course, on the post that in terms of the vaccination, I think that's where while we typically did I think we were number 1 or number 2 in the corporate space where, in terms of the number of vaccines that we administered, I'm sure we could have done better, moved faster on that space where we enabled the corporate employees and their families to get vaccinated, right? And again, the lack of clarity, regulations did play a part, but I'm sure we could have done something more, something stronger to make India healthier.
Talking about the corporate employees, so Care started with an intention to help NRIs to keep track of the health records of family members. So keeping in mind that Care has switched to a purely B2B company, how has pandemic affected the B2B corporate health and wellness market, and how is Care dealing with it, sir?
Very interestingly, work from home and the pandemic has actually fueled the B2B space. The reason why I say so is earlier you could do 10 things when people are in your office premises, which engages them as an HR, right? But now that they're remote, what is that one single thing that gives the highest return from a mental headspace for an HR? That is your health, right? And that's where the awareness from an HR fraternity perspective and the acceptability of the solutions, right, in terms of tech, from telemedicine to e-pharmacy, has actually started fueling the growth over the last 2 years from a corporate health space, right? And the fact, I'll tell you a simple example, right? Our sales team, at the peak of when the vaccination program was running, at the peak of that, our sales team did not have time to speak to HRs and explain them the process because of the insurgence of demand, right? Earlier there was a supply gap, now there was a demand gap, right? Wherein we were not able to get into that discussion and explain to the HRs or the MDs, right, who were actually interested and had made it mission critical for all of their employees to get vaccinated. And these are not small companies. I mean, I'm talking about the likes of Puma, Nike, etc., right? And that is the level of awareness at an HR level that has crept in or has been influenced. And if you see going ahead, the next key focus area for the HRs or the change in focus is the acceptance of mental health as a key factor in the corporate health bouquet. Till probably 2 years back, most of the companies did not consider mental health as an important factor. Now, with people separated, with people staying in their homes, and because of the imbalance of the work life because of work from home, mental health has become very, very critical as an offering or as a business line for us. Right? Now, having said all of that, I would just say that I'll give you certain numbers that would help you explain, right? Because at the end of the day, operations runs completely on numbers. So at a point where we were doing somewhere, we've grown our doctor consults month on month to 15 to 20x in the last 2 years. Our diagnostics numbers have grown 15 to 20x in the last 2 years. The pharmacy orders have grown 5 to 10x in the last 2 years, right? And these are all typical signs of, and the number of clients have grown 4x or 5x in the last 2 years, right? And that's the kind of demand that we continuously see in the corporate space. And there is more and more awareness towards it. From the employee space also, we've seen that there is a higher LTV that we are able to capture from employees now because of the kind of service that we've been able to deliver, right? So people do come back for more and more different kind of health requirements to Care once they've come onto the platform. So all in all, I would say that the awareness, the requirements have grown. And if you see in the next 6 to 12 months, I see the B2B space blooming significantly from different service lines, because it is, so if a budget is there of a certain rupee, right? Earlier, the budget that was there for employee health was 20%, but if you look at the recent studies, it is now going up to nearly around 50% of the employee welfare budget or employee engagement budget, because of the focus that is now coming on towards healthcare and because of the raised awareness.
Thank you, sir, for such great insights. So, Arijit sir, while we talked about the operational shortcomings that CIPLA faced and dealt with that, I wanted to know that what strategies has CIPLA adopted to better equip clinics, hospitals, pharmacies for situations similar to COVID-19 pandemic without compromising on its operational efficiency and maintenance cost?
I think there are many changes. CIPLA was one of the strongest players in the hospital sector. We were number 2 in the country, and we had tremendous reach of the hospital sector, whether it is the large bed hospitals or even the small nursing homes, less than 10 bed staffs and everything, right? I think what we did was, direct supply timelines, rate contracts. I mean, we have a team which actually looks into the hospital business, a pan-India team which cuts across therapies, which looks at hospital business. I think those teams have become much more quick in their, operations. Direct supplies have changed a lot, especially the high-end products, ICU kind of products, reach hospitals in hours. Once they raise a requisition, many of these expensive products like the monoclonal antibody and all, many hospitals don't stock them. Even the large hospitals, I'm talking about the Jaslokes of the world, right? Even they won't stock the product because they are, it's expensive for them, and they raise requisitions on a daily basis. And on a daily basis, they get supplied within 2 hours. I think these are things which we never experienced before. So those are the first changes. Second is insurance tie-up. Earlier, I remember OPD insurance coverage was very low. Today, OPD insurance coverage is high, especially even in COVID cases. Very recently, beginning of January, I had my second COVID, and I developed a little bit of breathlessness. So I thought I must, I was recommended that since you're having a little breathlessness, you should take the monoclonal antibody. It was a day procedure, fully insured. And so these are changes. So insurance sector's ability to go beyond IPD and look at other areas have also moved up. The third thing I will say is that though pharma companies remain pharmaceuticals and chemical, their primary focus is chemicals, but they've also started looking at overall healthcare ecosystem, whether it is diagnostic, devices, everything. And because of the reach that we have on customers, it's a phenomenal win for us. Like we started the diagnostic business, and our primary focus was that can I get the diagnostics business from a brick and mortar diagnostic center to individual doctor's clinic. That was the objective, and we've been able to do that. Today we have almost I think about 72,000 doctors who purchases our diagnostic stuffs, kits and diagnostic kits and stuffs, and then they give it to the patient at the time when they require it. So there's no slip up between what a doctor prescribes to what patient goes and does and everything else. So the diagnostic business, we were able to move from the diagnostic lab on centers to the doctor's clinic. Not everything, of course, but certain aspects of it we could move. Those were I will say that those were certain changes or strategies that we adopted, which have improved our business at hospitals and private clinics and smaller nursing homes. It hasn't impacted operational efficiency at all. Our costs are pretty decent, and have bumped up our opportunity with not just from a revenue point of view, but building equity, building goodwill with the doctors as well as the doctor community in many ways.
Thank you so much, sir. So, like the pandemic, because of the pandemic, we have seen a lot of transition and a lot of new things have become the new normal. So, I would like to ask that COVID-19 has highlighted the need to adapt and update clinical care delivery systems. So, there have been concerns also on moving away from the traditional face-to-face consultation and towards remote digital solutions. So, how has Talk Online helped people leave behind the inhibitions and consider online health consultation the new normal?
Yeah, I think one of the side effects of the pandemic has been that telemedicine has certainly seen a lot of trial. And I think the most difficult thing for any new product, as I'm sure you'd have learned in your marketing courses, about adoption, who are the early adopters, and then once you get over like a 10% threshold, then you start, that particular technology starts to get acceptance, etc. So something like the radio, for example, I think took 25 years before it was adopted by, a significant proportion of the population. So I think if you look at that, I think telemedicine has had a very interesting trial period or adoption period. I mean, I've seen some studies that claim that as many as 50 million Indians have tried telemedicine during the pandemic, which is an amazing number. So I think it's generated trial for telemedicine. I think that's the best thing, and I think people have used it. They have experienced it, and at least in our case, we have a very significant proportion of repeat patients, where patients, once they experience our service, they keep coming back. Their family keeps coming back because we focus a lot on quality, we focus a lot on the patient experience. I mean, in terms of, as you say, what is the risk, face-to-face versus telemedicine? So, I think there's, I guess with everything, there is a difference in the way something is executed. And there will be people who will provide high-quality telemedicine, and there will be other people who will provide not so high-quality telemedicine. And because healthcare deals with can deal with fairly serious conditions, there could potentially be problems if it's not done properly. But that's true with everything. I mean, that's not restricted to telemedicine. It's true with driving a car. It's true with going to a hospital. It's true with going to a doctor. I mean, there are good doctors and there are terrible doctors. And I think that's something that's true with telemedicine as well. I think if it's practiced safely, I think, we spend a lot of money and we invest a lot of time in making sure we recruit doctors carefully. We don't believe in impaneling doctors. We actually think of many of our competitors as doctor dating services because they take absolutely zero responsibility for the clinical interaction. They take zero responsibility for the outcomes. They simply check that the doctor has an MBBS degree and is empaneled with the appropriate medical association, and they add him to the platform. I think other people in the industry have a slightly different approach, and we are one of them with a different approach where we take full responsibility for the clinical outcome. We train our doctors, and one of the critical things we train our doctors about is red flags. That what are the red flags? You need to be very good at picking up symptoms or picking up potential serious problems where you need to then advise the patient that this particular call or this particular episode is not suitable for telemedicine and you need to go to a hospital as quickly as possible. So obviously if somebody is having a heart attack, for example, or there is a deep brain, there is a thrombosis or there's some kind of potential stroke, and if the symptoms are visible to the doctor can pick that up on the call. Clearly the advice has to be that, terminate the call and get to a hospital as quickly as possible. So I think there are precautions to be made. There is training required. The medical knowledge and medical field also evolves very quickly. So there's a need to constantly update your doctors with the latest protocols, with the latest thinking, with the latest diseases. So I think if practiced safely, I think the outcomes are very, very good. And personally, I've been in telemedicine now for about 6 years. So this is not, I don't think COVID, telemedicine is an answer for COVID, and post-COVID, there's no telemedicine. I just don't think that's that at all. I mean, we had plenty of telemedicine before. and we had a lot of patients who had an amazing experience with telemedicine before COVID. But what COVID has done is clearly that trial, and that millions of people trying it creates trial, creates awareness, creates adoption. And I think that curve has got accelerated, and certainly the curve has got stepped up in terms of that. And as Shami correctly said, that the telemedicine guidelines got codified. We don't think it was illegal before, by the way. We think it was perfectly legal before, but I think the codification has removed any confusion. It was a gray area, certainly, and there were some badly worded Supreme Court judgments. But the gray area has been cleared up by the telemedicine guidelines. Again, it gives the industry that much more confidence because you have a protocol, you have a training obligation, and so on. So that again helps to clarify matters. Yeah. So like I said, you can do something badly, you can do something well. Applies to everything in every industry and everything. And I guess in healthcare you've got to be particularly careful because you're dealing with people's health and potentially serious problems. But I think it's the adoption has been an amazing result of the trial, and adoption has been an amazing result from the pandemic.
Thank you, sir, for such great insights. So while we were discussing about pandemic from quite some time, so we had a question that what is something positive that came out of the pandemic personally as well as professionally that has evolved you as an individual? So Samak sir, would you like to start?
Sure. So I think from a professional perspective, right, I think we as an organization have understood where to focus on. It has given us a jolt which woke us up from the steady state and made us think differently. And that has now been incorporated into the DNA of the organization to innovate, to look at different ways of looking at the same problem and to question status quo, right? And that has given us the confidence in terms of the growth that we are looking in the next phase. On a professional level, I think the biggest thing is, and this is a word that is very common at Ekincare, at every stage of an organization and at every stage of doing something different, you have to first unlearn whatever you've learned over the last few years. And that is something that I think has been case in point through this pandemic. We've had to unlearn whatever we knew at the start on the first wave. We had to unlearn in the second wave. And that has been the biggest takeaway for me personally in the last 2 years.
Thank you, sir. Arijit sir, would you like to share your experiences?
Well, for me, I will say, on the personal front, let me talk first. I think, when we were small, when we were school going, I remember every time we used to go out to play and come back home, parents, especially mother, used to say that go and wash your hands, go wash your face. Without that, not allowed to sit on the table and whatever. And those were habits that we grew up with, right? If I would have said that habit to my children 3 years back, they would say that, why should I need to wash my hands, right? I think somewhere a virus ensured that these eternal, facts of health and hygiene are back, right? Today, no one has to say it. It just happens naturally when we go out and we come back. Even though I've used my car, I've not touched anything. I still come back home and wash my hands, and that's true for everyone around the house. So I think health and hygiene have moved up significantly in our priorities of our life. I think that's the first point. The second point is, I think often, in India, this is the fact that we used to take ailments for granted. Self-treatment, self-medication, anything happens, we would, we'll just pass it out like, a cough and cold, that's okay, that's fine. I think those awareness have gone up. Today, we don't take things for granted. We do certain, we will do some tests, we'll ensure that we are all, healthy. So the same point again, that health and hygiene and the seriousness of health and hygiene have moved up significantly. On a professional side, I will only say that, one aspect of, there are many, but one aspect of professional side which has impacted me significantly is the role of, looking at heart over head, which is what I say. And I'll give an example of that. We often in our careers, we think that, business at any cost. Business will come first, charity, no, why should we? We are a listed company. We should do things what is supposed to be done, right? Which is deliver profits for our shareholders and stuff, right? But some things taught me that there is much more than that, a layer below. And one of the habits that have changed for me personally is that I don't go to a salon anymore. I used to call the urban club guy at home, and he used to cut my hair. And then this guy became a regular. I think those awareness have gone up. One of the times when he came home, I asked him, vaccine liya hai apni? Haan sir, vaccine liya hai. And I asked him, kaun sa vaccine liya hai? He said, sir, wo Cipla wala vaccine liya hai. He didn't know I was working for Cipla, right? I looked at him and said, Cipla ka to koi vaccine nahi hai. He said, nahi sir, wo Cipla wala vaccine hai. I said, कौन सा वैक्सीन का बात कर रहे हो? मुझे सर वो जिसके बीच में वो 1 महीने का गैप है ना सर, वो सिप्ला वाला वैक्सीन है, मैंने वो लिया है, right? I didn't want to create a dissonance in his mind by saying that no, that is not Cipla's, right? I said, बहुत अच्छा किया है, ठीक है? But then I realized that somewhere in the social, lives of people, organizations have got embedded, right? Not because of what they have, but the goodwill that we have generated over the last 1 year. And that's when I realized that heart, sometimes prioritizing the heart over mind and head and commercials plays a big role. And that's what I would say is something that has come out of pandemic for me personally as well as professionally. A regular.
Thank you, sir. Mishra sir, would you like to share your experiences?
Yeah, I agree with what the previous two gentlemen said, both Somak and Arjit. I think they said it very nicely. I think I think the head and heart issue that Arjit mentioned is also close to my heart. I think that's I've seen that. I always believe that if you do the right thing for the customers will do the right thing. And once again, I think this. I have another example to talk about for my colleagues. When I tell them that it doesn't matter what it costs, if you promise something to the customer, we must deliver it. Don't worry about P&L. Worry about the customer satisfaction. Is that when we gave away telemedicine for free in March of 2000, March, April, May of 2000, because we had too many doctors and we had no demand. A lot of the corporates have stayed with us. They've converted to paid memberships, and over 90% have renewed with us. So I think that somehow it works in the long run. My board also asked me that why are we giving this away free? There are other ways to handle the excess capacity issue. But I said, look, this is the right thing to do at this time. We'll see what happens. It's already spent. Either you sack all the doctors overnight, or you make use of them, right? So the head over heart, I think, works even for your P&L. I don't think, and that's something that Excel also has taught me, and hopefully they are teaching the current batches as well, that doing the right thing will eventually pay out in the long run, creating the brand value Arijit talked about very passionately. But I think those are very, very important lessons that we've all learned, reinforced in the pandemic. I think personally, I would say in terms of my management style, I think I've learned to be more, strangely, I've learned to be more relaxed and more flexible. And to allow my team to do a lot more than I used to be. And I think work from home has taught me that sometimes doing less is more as a manager. And, I think that's something that I guess my learning was accelerated. That's something I should have learned 20 years ago. But I guess better late than never.
Thank you, sir. So it was a very informative and insightful session for everyone. I'm sure everyone must have learned a lot from this fruitful discussion. But before we move on to the second part of the event, which is the presentation round, we would like to take a quick 5 minutes break, and we will be right back at around 2:15. Thank you.
Once again, good afternoon, everyone, and welcome back to the presentation round of Mindscapes 2022. Before we start the round, I'd like to once again thank all of our sponsors, Deco Rally, Rubel Organics, Havish M Consulting, Elam Markets, Tiny Explorer, Cosette, and the Millennial Kitchen for partnering with us and for making MAXI at XLRI Delhi's first flagship event possible. So as we move forward with the presentation round, here are some pieces of information. The top 4 teams from a national level case competition held on D2C will be presenting on 4 unique industry problems that we identified. The teams will have 7 minutes to present their pitch deck, and followed by that, a 5-minute Q&A session will be conducted with our panelists. So without much further ado, I would like to begin with our first problem statement for our first team. So the problem statement goes like this: COVID-19 and tackling the impending patent cliff. On the 5th of May 2021, the American President Joe Biden delivered a shock by announcing his support for a proposal to waive patent protection for COVID-19 at the World Trade Organization. While his previous stand was in favor of holding up the protection, the criticism domestic and abroad has seemingly prompted this reversal. As we all know, capital expenditures, especially in R&D cost format, contribute to the most significant expense component for players in the pharma industry. This is validated by data collected from the CDC report, which indicates that pharma industry has the highest investment in R&D, with companies on average spending 25% on their revenues on funding the R&D expenditure. With this scenario as described, we've defined patent cliff as a phenomenon where a company's revenues and market share seemingly fall off a cliff when one or more of its established products go off patent. A particularly alarming problem facing the pharma industry in general right now, as they have experienced record profit and growth during the pandemic times, and do seem to be standing at a risk of falling off a steep cliff. With that in mind, this is the problem statement we've given to the team. With the pandemic seeming to hasten this drive towards the dreaded patent cliff, the objective for the team is to ideate means through which pharma companies can better prepare to combat this seemingly inevitable problem. For the reference of the panelists, the problem statement is also mentioned in the Zoom chat box. Without further ado, I'd like to request Team Loss from the Indian Institute of Management, Bangalore, to present their solution to this case. You can go ahead, Team Loss.
Sure. Thank you, Raj. I'll just share my screen. So, good afternoon, everyone. So, we are from Team I am Bangalore. Our team name is Lost. So we are here with Anandaroop, and sadly, Urja can't join because she has contracted COVID today morning. So, as Raj mentioned about the problem statement, so let's go, without further ado, let's go to the solutions. So we did some research on LinkedIn. We did surveys to about 30 pharma companies, including Glenmark Pharma, Sun Pharma Chemicals, and a lot of other companies, out of which we interviewed 3 major vaccine suppliers, one being the Pfizer company, the other being the Cipla, and not Cipla, but I would say, and the other being the Bharat Infotech. The main question that comes there was the R&D cost too high? Were the tax benefits alone was sufficient enough? The supply chain constant, if they have received any, and if there's any technological innovations needed for further improving the vaccines. So there are different companies which say differently about different questions. The main insights which we received was the technological advancements which was received during this period was very slow, and as a result of which R&D facilities were lacking in funds. So the main issue during this period is, if the patent is being waived, not only tax benefits can alone let the pharma company to run the R&D facilities, because it takes a lot of money to do research on these vaccines. The next thing is the changing consumer preferences and the anti-vax sentiments that is being worried. So people these days are now of the opinion that a herd immunity is most important rather than getting vaccines. So Now, there's also a growing demand for booster shots, and other alternatives to vaccines are also being developed. There's a highly competitive market is spread, and government regulations are also like creating a problem for the pharma company by licensing them more and waiving of patents. The main criticality of these issues were, now if there's a global decline in vaccination rate as we are getting more and more prone to COVID, what will happen to the pharma companies? COVID helping drive business, but what's next? What are the creation of robust R&D vaccine for vaccine development? So as you know, we still haven't developed any robust vaccine which can immune us from every available types of COVID viruses. To the next page. So here we have discussed about a consumer journey. So and solutions which we like to give in the initial phases. So pandemic started in 2019, as we all know. Then what the pharma company started is developing effective vaccine against the masses. So initially there were patents, but later on, as Joe Biden states, the waiving of patents so that COVID vaccines could reach out to more and more people at a much faster manner. But one thing we should know, that waiving of patents doesn't mean that COVID vaccine would reach to at a much faster manner. It means that it is a small step towards the entire vaccine development. So what we have decided is we treat awareness in the sense like this is the importance of effective vaccine. We can make any vaccines, right? But it's not necessary that all the vaccine will work under different situations. So for making an effective vaccine, it takes time and it also takes money. So for that money, we need patents to be developed. Now, explaining the country leaders the need for patents in manufacturing and in R&D facilities. The waiving of patents, as I told, it won't speed up the vaccine supply and the number of technological innovations needed. The attentions that need to be taken by the government in each country is suspending IP rights to vaccines will remove the incentive for drug companies to innovate. As I told, every innovation needs certain amount of funding. The pharmaceutical, there's also a study by the McKinsey that the pharmaceutical lobbyists working against the proposals include like Mike McKay, a key fundraiser for the House Democrats, now working on retainer for Pfizer's. Now, the other things which we found out is trust. About trust, successful vaccination campaign also requires government to partner and support community organizations. There's also actions like proactively releasing timely information. By serving different pharma companies, we found out that trust is one of the major reasons why different people don't take different types of vaccines. Because there's not the smooth flow of information that is being transferred from the pharma company to the public. As a result of which, people believe that pharma companies are using their funds for anything rather than using it on R&D facilities. So this smooth flow of information is one of the key reasons that would be beneficial if we provide it to the public. Now, how to retain it? Enhancing transparent and coherent public communication and also the misinformation that is being provided. So, as you know, initially, Covaxin was developed, but Covaxin was thought to be like it is not prone to, it's not immune to the COVID. But later on, as more and more people get to know about the shots and about the viruses, they also get to take about the different vaccines. As a result of which, in early 2021, there was not much of vaccine that is being developed and not given to the people in India as well as in other parts of the world as well. So, but later on, what people did, people are taking more and more vaccines and even taking the booster shots. Now, Anand will continue about how the solution is to be developed.
Yeah, so we have to develop a strategy to fight the patent cliff. We have identified a few major factors like reducing sales erosion, future-proofing it, product differentiation, and marketing strategy. How to future plan it? The company should be looking at the LOE pre 2 years and develop better R&D to launch a competitive product or a newer product. The product offering should be such that they cater to the mass market availability. Releasing OTC versions with different formulations or a smaller dose can be a solution to it. Adjusting price points and market positioning is very important in the sense that bigger pharma companies should not be fighting with small cap manufacturers. Avoid bidding wars, which will be increasing the COGS, and rather suspend on marketing or sales investments, adjust inventory levels for decline in demand products. Focus on new brand and attempts to upgrade the market. We have developed two particular models in the sense that we can have an omni-channel strategy of offline plus online model. The offline model will focus on tie-ups with different institutions, centers, and focus on things which have a higher customer send to increase customer loyalty. While the e-commerce center developing dashboards, particularly UNICEF dashboards, which can connect manufacturers, producers, and distributors together, would be a binding factor so that different stakeholders can manage the vaccines better. Moving on to the next slide, we have developed two campaigns here. Maya, could you please change the slide? Yeah, so we have developed two campaigns, the basic feature of which is dependency on repeated R&D success and making sure that the pharma companies are become the market leader in the brand for COVID-19 vaccine. We have identified a few major strategy points like patent clusters, patent settlement agreements, and product line extensions would be very important to develop R&D success repeatedly and gain competitive advantage. Brand recall for bigger companies is larger, as a result of which different mutations of vaccinations that appear, they can reach the market first but through better R&D. While
Thank you, team. Your time is up. Thanks a lot for the presentation. I would like to invite the panelists to ask any questions or queries from the presentation.
Hey, hi. I'll go first. Couple of questions from my end. So, just to summarize, Andrup, and my quick question is: should the manufacturers be really concerned about the patent cliff, keeping in mind that this is only restricted to COVID vaccines? And should there be an actual urgency to define a strategy around it?
Adding to your first question, I don't think it's only related to COVID vaccine. It's more suited to different types of vaccines, and not only vaccines, the drugs that are also being developed at different pharma companies. As you can see, most of the pharma companies make medicines, but most of them are not patented. And even if they are patented, after a certain point of time, we get a different varieties of vaccines, which is much more modern, right? So I don't think it's not only situated to COVID vaccine only, but yeah, manufacturers really need to, this is a worldwide scenario where every pharma companies have to think differently, and not only COVID vaccine, but after COVID. Like COVID is now, but what about after COVID? After COVID, different types of vaccines that is being continued to develop, or drugs that is being continued to develop, people need to look at it like how they should settle for this. Sorry, could you get a second?
Just adding on to Mayuk's point, this is also a situation of future-proofing the industry. Basically, if the pharma companies do not look at the problem of patent cliff occurring in the future, let's say for something that is expiring 2 years down the line, there would be a situation where if they do not develop a strategy, other smaller players, which can have a cost advantage because say they've reinvested in an emerging market. So that emerging market can be lost for a larger company. So the company should be focusing on a strategy so that they can reallocate their resources better, improve the supply chain, and in the sense that reduce the cost of generating the particular drug. The R&D has to be improved at all costs, but improving R&D in a sense with a strategy such that the solution is future-proof is something that is required.
Got it.
Any other questions, sir?
Well, I have a question. I guess the project which was assigned talked about that vaccine manufacturers who have gained significant revenue over the last 2 years are not going to have that kind of windfall going forward, looking at one is the booster shots and everything and the overall herd immunity that they've been able to generate. How do they manage their P&L considering that they'll not have the windfall that they've had before? Right? I guess that was the ask of the project. Am I right in my understanding?
So, sir, it was partly what you said, and partly about the impending patent cliff. That is, if patents are being waived, there's still a discussion that is going on, debate that is going on across the world, that what happens if all the patents that is being developed for COVID vaccine are being waived. In such cases, what are the issues that company would face? Would the company would go go on producing the same vaccine or developing the same vaccine, or in such cases, if the P&L falls, if the market share of the company falls, what happens in that cases? In that cases, what company can do is like either they have to shut down, or not shut down is a very extreme case, but yeah, they have to improve their supply chain policies.
Fair enough. Now, considering that being the question, one is you're treating vaccine same as any chemical entity, right? Which is not a fact of life, right? Because development of vaccines and the development of chemical entities is a very, very different game, especially from a time frame point of view. Were you able to capture these the nuances of that from the question specifically asked to you with regards to vaccines, especially vis-a-vis a general case of a chemical entity?
So, sir, to answer your question, based on our survey, what we found out is like every pharma company doesn't treat this as the only chemical entity, since they have different all types of products, first of all. Secondly, this is a worldwide phenomenon that is being observed after Joe Biden said that in World Trade Organization. And the third is like what the company manager said is, they said like, let's say we not treat the COVID vaccine as a chemical entity, right? In such cases, what will happen is like the COVID vaccine we are making right now, that will get unanswered in the market. People won't trust it in the future, right? The COVID is going to stay, let's say, for next 1 year, at most 2 years, right? And even if that happens, there's a different modern facilities and competition that are also being developed during this period. So as a result of which, to compete with the market and also to make sure that their R&D facilities get the proper funding and proper technological innovations during this period to improve the drug. So they think that this is one of the major factors they should look upon. Not as a chemical entity, but as a COVID vaccine.
Okay. Just for your information, guys, most vaccines are an outcome of a virus that you're trying to attenuate and do it. So there's hardly any patent protection. No viruses have patent protection. So I can create a vaccine for any virus that I want, right, through my process, right? Having said that, the difficulty is not the patent. The difficulty is more related to how you do it, because it's very difficult to have biologics being worked out from a development point of view. Okay, thanks. I don't have any further questions.
I have one. Given that the vaccines are highly regulated, COVID vaccines specifically are highly regulated in across countries with the government intervention, how do you think this problem has, or this problem statement correlates to the government interventions?
One of the major things we found during our research was the fact that there was a concern about IP waiver, because they are providing a shortcut to competitors looking to acquire expensive technology. Like, companies say that IP relief will not only accelerate vaccine manufacturing, because materials are also in short supply, and throughout the different countries, the situation is not the same. Governments that are opposing the waiver due to regulations and other such means, they argue that the WTO rules already allow countries to apply for compulsory licensing to override IP. I mean, during emergencies, for example. So say a smaller country like Bolivia is applying to the World WTO to use this process to allow to import COVID vaccines. So that I believe the regulatory regulation should be done in such a way that it does not block exports of COVID-19 vaccine and their components. It is right that it is called out, and in the sense that these arguments need to be addressed with the sense that as the pandemic goes on, we are not exactly sure about what exactly will happen in the future. There can be other variants, and there might be other mutations as well. So the core problem here is the vaccine manufacturing, and research and development is that concentrated in a small group of high and middle income countries. That is the issue here. And that is what we are trying to solve.
Got it.
Mishra, would you like to ask any more question?
Just a quick question. Did the group consider the arguments for patent waiver for either COVID vaccine or other vaccines? Because many people argue that there should have been the only way the epidemic or the pandemic will stop is if the vaccines are used in a vast majority of the adult population of the world, which is unlikely to happen given the current vaccine cost. And a second sort of supplementary question was that, did they study any old vaccines which have no patent protection? I think it was already mentioned that if it's the vaccine is based on a virus or a dead virus, it cannot be patented anyway. So did they look at any old vaccines that could serve as a business case or a learning which are currently being made in a profitable way or unprofitable way, where patent doesn't come into the picture at all?
Right, sir. So I'll take the first question. First question, yes, we did this from the pros perspective, like what will happen if the patents are actually being waived. So when Joe Biden told it, he has a good motivation to reach to more and more people, so the vaccine could reach more and more people in a short period of time. But what he didn't know is like this also requires some technological innovations, and at the same time, what are the factors that is being involved towards the making of a vaccine? Like we can't, as I told before, and as Somak sir also said, we can't just make any vaccine and give it to the population, right? So as a result of which we need to do a research. But for that research, the tax, the fundraisers' money, the tax that is being paid is not enough. So yes, waiving of patent was a good option. But waiving of patents doesn't mean that vaccine will be reached to the mass much faster. What people need to know, as we said in our third slide, we need to aware people of how vaccines are being made and what are the major factors that is being affected, how we are making the vaccine, and by how much time we reach to the population. And at the same time, there should be a smooth flow of communication between the pharma company that is developing the vaccine, like how much progress it is done, and many other factors. And should tell it to the mass, so that mass also like get to know like what are the factors that are being involved in making of a vaccine. Not just you can make any vaccine and make it patent waive and you can just give it to the population, right? Adding to the second question, sorry, sir, we haven't researched any previous vaccines in this case.
All right, thank you.
Thanks a lot to sir. Thanks a lot to all the panelists for asking such insightful questions, and also thanks a lot to Team Lost for the presentation. So I'd like to go forward to this next team, and before I do so, I'd like to introduce the problem statement that they were assigned. Here it goes. In India, the COVID-19 pandemic has thrown an open challenge to the reconfiguration with respect to care in hospitals in response to the pandemic. This has led to many patients suffering from non-COVID conditions having to delay their treatments. The healthcare system in India was on the verge of collapse by the time the second wave of the pandemic hit, and with many hospitals unable to cope with the constant influx of patients while simultaneously running out of beds, oxygen cylinders, and other necessities. The problem statement to the team goes as follows. Their objective is to identify the effects of the COVID-19 pandemic on access to healthcare systems in the post-pandemic era. They also are tasked to suggest the future roadmap to tackle the challenges that they've identified, especially in small towns and metro cities in India. And again, with this statement, I've already posted it in chat for better viewing. So without further ado, I'd like to request Team Stilettos from Great Lakes Institute of Management, Gurgaon, to present their solution on the same.
Thank you so much. Good afternoon, everybody. And we are Team Stilettos with Sonakshi Srivastava and I, Shubhi Mathur. So today we're gonna present our analysis on the Indian health industry and what the objective Raj mentioned previously. So let us get some brief or some highlights about the healthcare industry first. It is the third largest in the API market, that is the active pharmaceutical ingredient. It has also in the 10th position in the medical tourism index, and it is competing head-on with France and Abu Dhabi, which it has also comprised with 29.5% of GDP. Well, e-healthcare market has also seen a boost in both tier 1 and tier 2 cities and comprise of $10.6 billion. So that is a big raise. It has also seen that in-patient healthcare, and it has been increased by 70 to 80% in India as well. Moving on to the challenges that we have identified during the COVID-19. First is the supply chain distribution. There has been a lot of reduction due to the travel restrictions, and the logistics have been impacted a lot. That is the first statement that we identified. The second is the engagement opportunities. The in-person engagement have, we hardly go to the physician, and the digital engagements are more. So, which has indeed affected the face-to-face collaborations as well. Delays in the clinical trial have also been a major factor, as there are less opportunities in terms of designing, recruitment, and enrollment in particular for the R&D department. It is gradually coming into pace with all the technologies and all the as people are adapting with the new conditions. Managing drug shortages is one of the key challenges that was identified. And as far as I remember, there was one time in Mumbai in 2020 where it was very difficult to get even a hand sanitizer in the general store. Moving on to manufacturing unit to a new store, and there are new legislations, like rules and regulations that are imposed by the government. Those are also be taken into consideration while developing a particular drug or dealing with any situation or any crisis that are coming with the COVID-19 norms, like COVID-19. So that, as we are moving to the digital world, there has been a risk of cybercrime. There's always that risk that has to be coped. Well, there are some trends in the healthcare industry as well. First is the blockchain. Blockchains, it is a highly secure method where we can even assign the transparency level to all the employees. Suppose there is suppose the R&D department wants to give the manufacturer some info about developing a particular drug. They will directly give them access on the same chain to a certain extent that will help them to generate the drug, and it will not even hamper the company's security systems. And there can be other implications as well. Second can be the AI securities. Artificial intelligence is coming everywhere. We can detect thefts, and we can even eliminate a lot of negative or error opportunities that are there, so that we can have a definite unit that is very much possible. If we see the right hand side graph, that shows the adoption of blockchain in future from 2020 to 2027. We can see the pharmaceuticals is the industry which will adopt most to the challenge. Well, moving on to Sonakshi.
Thanks, Shubhi. So we all know what tourism is, but if a person visits your city or your country for getting themselves treated, then it's called medical tourism. And India has a huge scope for it, and it has been trying to cultivate it as well. As we all know that we are a land known for Ayurveda. But at the same time, the doctors have been able to cater to the mass audience by attracting foreigners to come to our country for getting themselves treated for orthopedic, infertility, cardiology, or even weight loss treatments. Coming to the supply chain part of it, as should be mentioned, because there was a huge demand of sudden, as soon as the COVID-19 offset, so there was a huge demand, and because of this, there were a lot of problems observed in the supply chain. Something like lack of raw materials, lack of distribution, and as Shubhi mentioned, there was no sanitization. Even those kind of things were issues that was faced not only in the manufacturing process as well, it was even after the product distribution as well. So from this, we could see that there was this huge trend of companies now shifting towards more automation, or I should say hyper automation, which is in reference to Pharma 4.0, where now companies have been trying to introduce more autonomous and computerized systems, which will help maintaining their whole infrastructure, as well as compiling their assets and seeing that if there is a smooth flow between in their hospitals or in their supply chains or in their distributions. So, and with that, they've also tried to introduce electronic batch records, which will help minimize non-added value activities and create more faster visibilities and help people, get their supplies more fast. So, for the future roadmap that we've come up with, so what we from this all with specifically with the introduction of AI, blockchain, and hyper automation, we hope that with these with them introduced in the supply chain as well as the whole hospital care as well, this would help in reducing the delivery time, help in with AI and blockchain introduced in the supply chain. Inventory management can be done. Authenticity of your drugs could be done. There would be a transparency in the whole delivering process. And at the same time, with hyper automation, with a centralized data centers, doctors will be able to have the medical history of patients. So this would really work out in the tier 2 or tier 3 cities where they are still coming up with digitalizations, and there they were, during the COVID times there were a lot of shortages as well. So with this, they will be able to cater to those audiences as well, and they will be able to cater to the last mile delivery as well. And from this, as every place, every tier 2, tier 3 cities are able to access medical services as well, they will have a chance of increasing their medical values and the tourism as well. So that's all from our side. Thank you.
Thanks a lot, Team Stilettos. Now I'd like to open up the discussion for panelists. Be very grateful if you have any questions for the team.
Team, this is very well structured. I will say that very well structured and thought through areas that you've covered in what could be the potential, opportunities and challenges that post-COVID one could see. Right? But did you consider that what are the possible disease areas which has a propensity to show up as more problematic areas going forward post-COVID, right? And in what way your problems, your solution is looking at solving some of those specific disease areas?
Yes, sir. With the COVID increase, there has been a decline in the immune system of general population. So that will in turn make humans more immune, more actually prone to the diseases, the general disease as well. So if we use these technologies and have a proper patient record, like using the blockchain, it will be very secure. It will be highly, personalized for the particular patient. We can prescribe them particular drugs and customize for them only.
And so with all of this, I mean, not really. We did not really look at it in the broader sense, but like for diseases, it's like as we are now connecting it to the last mile as well. So we will be able to, and we are hoping for a centralized system. So with this, we'll be able to focus on and discover diseases which may be, particular to some places. Like I think everybody may have heard about this, that there is something called a Bombay blood kind of a group. So that is through studies and all that. So you can find, if we have a centralized system, you'll be able to figure out that what are, categories of infections or some kind of a disease is very common in a particular area, and how they have been treating it, what has been helpful, what has not been helpful. So it will not just help for the patients as well, it will help in the industry as well, that they will be able to research more about it. Because there would be a more information exchange from local, because India is known for their local, jugars as well. So with that help also, you'll be able to figure out that what is working, what is not working. It will help in the R&D as well.
Okay. My next question would be that, see, post-COVID, a lot of consumers have a lot of query regarding healthcare, right? what is that you're looking at from a consumer point of view? See, if I'm a patient, I'm fine. I'll get into your record system, central record system, and I'll be monitored and stuff. But if I'm a consumer, right, and I start having more of migraine pains, headache, for headache, and it's an established fact that migraine is one of the areas which will take a huge bump post-COVID, right? Now, if I have a headache, I'm not sure whether I'll consider this as a migraine or I'll just consider this as a headache or self-treat myself. So what are the consumer areas that one should look at from post-COVID awareness, information sharing that you could look at?
So there is a lot of information that is available on the internet, but that is not properly distributed. It is very mismanaged, that I can say. Like every single thing can lead to, human mind can amplify something, and a person can mistreat themselves. So we can offer them a particular page or a particular a platform where they can put the systems, and we can prescribe them a particular healthcare, like in person or a doctor or some home care system for them through the technology.
Basically, because we are keeping record history, so we could actually help identify the person from his past experience. If it is a migraine person with a migraine issue, if it's not, then we can say that okay. We can offer because it's all hyper automation and everything. So I think we'll also be able to introduce face-to-face consulting and all of this. So that can be digitalized. So then they may actually be able to consult a doctor, or they may be able to access some other people, their files and understand what they've been through.
Okay.
The introduction of neural networks as well, if they can input the correct symptoms, and if they are repetitive, we can run it through an algorithm, and we can easily predict like what is the patient suffering from, and how often, what kind of medication we can offer him as well.
Basically making a digital portal to understand what you're feeling. So it will, because it's a centralized system, so the systems would be able to, using, as should be mentioned, neural networks and all of these advanced analytics technology, they'll be able to figure out that if they are in a chance of that or not, and should they consult a doctor for more clarification or not, according to that.
Okay. Thank you. I don't have any further questions.
Hey, hi guys. Couple of quick questions. One, what do you think is the major roadblock to adoption of a standardized health records platform across India?
So lack of awareness, and there are less skilled employees to implement the facilities at the moment. But we are moving ahead on adopting more technological paths.
So basically digitalization as well, because thanks to Geo, we've been able to finally reach out to those remote parts of our country, but they still need to upgrade a bit. So we're hoping that is why we wanted to go not just to the main cities, but to the last mile, to those rural areas as well.
Yeah, so that's why my question is, right? What is the main constraint that you see in terms of the adoption or the execution of this or the solution that you mentioned in terms of the personalized or the electronic health records?
So I think internet then.
Right. Got it. And the other question is, what do you think is happening on these lines in India at this point? Have you done any research around that in terms of what is happening around the health records front? Is there something that is ongoing, not ongoing?
So as far as we remember, the Indian government is financing or is moving ahead with the blockchain technology, and they are even using the 3D printing technology as well. However, it is we need to pace this up so that every person in the tier 2
after COVID, they have come up with one or two schemes which are focusing on more centralized distributions of supplies, and they're trying to come and reach to these other ends of the cities as well. So they have come up with concepts, and they are trying to introduce all of these hyper automations and all of the other things that we mentioned.
The other
It's like a government initiative themselves.
The other question that I have is slightly different. While you've spoken about solutions on the pharmaceutical industry, there is another significant chunk of the industry which uses the pharmaceuticals, which is your healthcare delivery industry, right? What were did not see much on the healthcare services or the healthcare delivery industry in the deck. Is there any thought process that you would want to highlight on that side?
Actually, we were talking about healthcare as like a whole thing. So we are not just focusing on the, the hospitals or themselves. We were hoping for this to be a very centralized thing in the overall process. So that will include delivering as well.
I understand the EHR front. I'm talking for the other challenges that you mentioned on the second slide. We didn't see solutions for those challenges in the subsequent slides. And hence, I just wanted to check if there's any thought process around those challenges which were around the services delivery.
No, so we were more focused on the supply chain and getting to the people. That was our main aim.
No worries. Okay, I think that's enough. That's all from me in terms of the questions.
Hi, thank you very much for that presentation. Very nicely done. I was just looking at the problem statement, which was really about access to healthcare. I was wondering if you could summarize for me what are the top 3 reasons why a majority of Indians don't have access to healthcare?
So the first thing that is like lack of awareness. They do not accept that they are suffering from something. Even if they are even if the person is feeling anxious, they'll just lie down, sit for some time. They will not go and consult a doctor. So that is the kind of mentality that we have to change in the Indian population to move ahead.
The second one is internet connectivity, because that is what we are focusing on. So people will need access to avail all the facilities that we are giving it to them. So that's our second challenge. And the third one would be, majorly have these 2 issues, that people are not aware, they're not willing, they have all of this superstition and hoax. And the second one being internet connectivity.
Right. Okay. You clearly focused on the digital aspects, which is interesting in terms of blockchain, internet connectivity, etc. I'm wondering whether you had a look at what the NDHM, which is the National Digital Health Mission, what are they trying to do, and do you think that will have any impact on the solutions that you presented?
So we've not really heard about it, but if I'm right, I think it's because the telecommunication system that they've set up.
No.
It's all right. It's all right.
So we didn't research in that aspect.
Yeah. I would just recommend that if you're interested on the digital aspects of healthcare and EHR and this whole issue of maintaining digital health records, I think there's a lot of very, very interesting and I would say amazing developments that are happening as we speak. And I think it'll be useful for you to just Google NDHM, National Digital Health Mission. I think there's a lot of information available on that mission, which directly addresses some of the challenges that you identified.
Okay. Yes, sir, we'll do that.
Sure, sir, we'll do.
Thank you.
Yeah, thanks very much. Thank you. Nothing else from me. Thank you.
Thank you, sir.
Thank you, sir.
Thanks a lot, sir. Once again, thanks a lot to all the panelists for the incredibly insightful questions. Also, thank you, Team Stilettos, for the presentation. Now,
thank you, all the panelists.
Now, I'd like to move forward with the third problem statement for the third team. So the statement goes as follows. COVID-19 pandemic drives the necessity of ongoing digital health advancements. For example, the risks with in-person medical healthcare consultations increased, making virtual consultations necessary. Despite this amplified need, it is apparent that digital technologies will continue to transform healthcare over the course of the foreseeable future. Growing and aging population also need easy to use and affordable healthcare solutions, but still a large amount of Indian population does not have an access to these solutions. Usually people have a difficult time accepting and adopting new technologies, and this is especially seen true among elderly, as there is low digital and health literacy. So with the context as summarized above, the problem statement for the team is follows. The objective is to identify how you can make digital health care available, accessible, and comfortable among different age groups and societal levels. Once again, this problem statement and case has been posted in Zoom chat. Now, with the situation described as above, I'd like to request team ones and zeros from the Indian Institute of Management, Raipur, to present their solutions on the same.
Yeah, good afternoon, everyone. I'll be sharing my screen. I hope my screen is visible and I'm audible.
Yes, your screen is visible and you're audible.
Okay, so I'll begin. So hello and very good afternoon to everyone present here. Today, I along with my team ones and zeros will be talking about a digital ecosystem that can help us bridge the gap between digital healthcare and the people and make it more accessible to them. To start with, we wanted to identify an opportunity gap where we can work on. In front of us were some of the most astonishing statistics, which said that by 2050, India's population will increase by 46%, whereas the internet penetration is below 25%. The urban-rural divide and the aging gap are the other factors that contribute to the fundamental gaps in adoption of technology. So we thought, what's the closest thing that majority of India has come to when we talk about digitization? And the answer was right in front of us, Aadhaar card. It's currently being held by 99.7% of Indians and has the ability to digitally identify people. Can we leverage this to build an ecosystem of healthcare? When I say ecosystem, I mean taking all different components of healthcare online and leverage it using the modern age technologies like artificial intelligence, blockchains, and make their network that works in harmony. To give an overview, similarly, Aadhaar card will be distributing a health card, which will contain a unique health ID. This health card will be connected to different aspects of health card holders. For example, their health registries, their health claims, and other health information. All these can be clubbed together, and a health data analytics can be run on them to give us an insights which can be used to make e-pharmacy networks, healthcare apps, medical repositories, and e-hospital, etc. So the chain could actually continue. For example, the repositories could actually be used for building a better blood bank networks in new drug development. So our primary objective would be to create a state-of-the-art digital health systems which establishes and registers at appropriate level and to create a single source of truth. So this would enforce adoption and open standards by all national and digital health stakeholders and help us create a system of personal health record. So we also want to promote development of enterprise class health application systems while adopting the best principles of cooperative federalism. So as the side product, this will also fulfill the objective of better management health sectors and will enhance the efficiency and effectiveness of government at all levels. So in all, we'll be establishing a citizen-centric healthcare systems, providing an easy accessibility and equality to health services on a single platform. We'll be managing core digital health data and maintaining database of all the data. We'll be adopting open standards by union territories as well as the state governments in order to achieve sustainable development goals for health. Now moving on, Kirti will take forward from here.
So as the government is already taking initiatives in this direction, so the proposed structure is the collaborative initiative between the ministries, and the structure will be headed by the Ministry of Health and Family Welfare, and the committee will also include the scientific advisors, ministers from Ayush and Niti Aayog, etc. The operations will be carried out with the National Health Authority of India, and the legal authority will help in take care of all the laws and regulations. So the implementation is basically rolled out in 3 phases. The first phase will be comprises of a pilot run, which will be in the union territories, and in the second phase, it will be implemented all state-wise, the district level, then the villages. In the third phase, the target is to cover all health insurance schemes across India, along with the promotions and campaigning for the digital literacy. So through iDoctor, the health experts and doctors will be onboarded, and after verification by NHA, they will be registered by their unique ID. In the second phase, the new guidelines releases on all the notices regarding the recruitments of doctor and their vacancies in different areas of the India will be thereby done through this portal, and there will be a real-time rating and auditing of these doctors. As we have already mentioned, that each patient will be provided a unique ID, and also the hospitals and labs will be provided a unique ID, and there will be a regular health audit using the national standards, which will bring conformity across all the states. All the health benefits, insurance providers, the third-party insurance providers, and the schemes the individuals are availing will also be stored in their database system, and which will be powered by analytics, and thus further help the government in policy making. On the ground level, in the rural areas, government take help of NGOs to bring awareness in public and encourage doctors and practitioners to adopt the digital platform. Moving on to Sundari.
The blueprint towards digitization of health is recommended to have a federated architecture rather than a centrally operating entity to ensure interoperability and more privacy. The infrastructure layer to establish secure networks, a data layer which will manage data across verticals. These verticals include patient identification, drugs, and then comes the basic technology building blocks layers. These are spread across local, state, and national level, with each level operating at different levels and having different access levels, like information exchange, consent management, anonymization. While the design and creation of these layers is viable, educating and supporting all stakeholders and integrating them in the ecosystem still remains a challenge and is still the key player. The minimum viable architecture will include a digital interface at one end with the federated structure keeping the all three verticals intact. At the national level, DigiDoctor, Health ID, Facility Directory, etc. These will be working through the health cloud. At the state level, the e-hospital system should be available with repositories and federated registers being available. At the facility level, we focus on e-health cards, PHR web viewer, and web app that will be available. To measure the efficiency of this implementation, we came up with a few KPIs and divided them into the following categories. The first being internal metrics. These pertain to the functioning, which includes software quality, staff burnout, number or latency. Performance metrics like touch heat maps, which helps us to identify user experience, app latency. External metrics like clinical outcomes, which might include readmission rates, patient reviews, and then finally the engagement reviews to check our platform viability, like number of active users, month-on-month growth registrations. Next slide. The entire model in place comes with its own risk, but equally anticipated outcomes. The most evident risk being data security and how private as well as public stakeholders are going to adopt this architecture. The second being, since the technology is constantly evolving, how difficult will it to adopt and integrate into the existing system? The NDHM, for example, right now follows an ISO 31000 for risk management. The expected outcomes are at par. They include diverse and effective benefits, addressing fundamental problems like centralized health records, unified services for better outreach, and above all, a data-driven approach which will enable analytical decisions and a better policy making. If we are able to implement this infrastructure, we'll be able to improve the storage and access of medical data, ensure transparent pricing, as well as standardized and accountable services for both public and private health centers. The budget for this is expected to be at 144 crores. Now, Kirti will take over.
So as there are many private players in the market also and the government, but the integration of both these is not still there. So we are making a digital strategy implementations to accelerate digitalization of
your time is up, team 1s and 0s. Thank you for the presentation. I'd like to once again invite our panelists to ask any questions or queries that they might have about the presentation.
Well, I think, can you hear me? Yes. I think you've covered quite a bit on the digital side, and the way you've gone around is pretty structured and pretty clear. One area which did not come through is that there is how do you get the, how do you get the basic databases linked up with the existing population Aadhaar card systems which is there, right? In the sense that once you have those information, Aadhaar card is the right way to go through for creating that network. But how do you get that information regarding a consumer or a patient into the system, right? How do you do that? Because there is always an infrastructure challenge in terms of in a hospital setup, right? There are less number of doctors, staff, and everything else, right? How will you ensure that this information which is sitting on a patient gets into the system for the entire network to come alive?
I'll take on that, sir. So just like Aadhaar card, government also came up with a system called DigiLocker. So it's like a repository where all your other documents that are actually linked to Aadhaar card could actually be stored in a very secured manner. So this after if this is implemented, we could actually leverage that particular DigiLocker platform to collect all the data and maintain all the repositories, and to like it will gradually happen. It won't happen spontaneously that everyone suddenly uploads their medical pass, medical records, and everything. So when this is introduced, what could actually happen whenever someone visits a hospital, be it any hospital that is actually having a license to operate in India. So they could be there could be norms which could say if you give any prescription or anything, that has to be there has to be a digital copy of it, and it has to go to the DigiLocker account of that particular person holding a Aadhaar card. So this way, the network could actually start functioning.
Adding to what Aman said, there's already a particular health infrastructure in place for the Pradhan Mantri Jan Arogya Yojana, where there's a community cloud and it has data from all the health claim platforms and as well as rural areas. So we can probably begin with integrating that.
And if I talk about the scaling, like everyone now has an Aadhaar card. So we are also planning like everyone will have a health ID, which will be used in like while you are taking any insurance, or while if the patient is admitted in hospital, through a single ID, all his history, all his prescriptions, all his insurance providers will be on a single dashboard.
Okay.
So while you've spoken about the digital health infrastructure and how NDHM is looking to enable it across the country, one thing that was part of the problem statement was that how do you make it accessible and comfortable for different age groups and societal levels? So what is the thought? What are the key challenges you see in that comfortable part? I'm more concerned about the comfortable part than the accessible and available, because I understand that you covered most of that. So how do you make it more comfortable across different age groups and societal levels?
So just like an Aadhaar card, every patient will have a health card, right? So it's the operating point for them. Like if they go into hospital or in a clinic or to the doctor, it will be the interface, and the operation part will be more towards the hospital desk. It will be much lesser for the patient itself.
Adding to this, the incentives, like people run after incentives. If you offer them something that if you go for a health card, you'll get this. So people will, the majority of people will become comfortable after for using it. So there could be a certain incentive that could be attached to this particular health card. If you go for keep on using the health card for more than this particular duration or something, so you will get a benefit. The elderly person of a certain age group who are above 65 or 60, they would get this particular rebate or something on their clinical checkups or something. So people would become more comfortable and adapting towards the card.
And in rural areas, we can set up, like in rural areas, there are primary health centers and community health centers. So we can do campaigning through them in the rural areas. And also if we compulsorily do, like the government benefits will be linked to these health cards, then people will definitely go and go and take these health cards to avail those benefits which the government is providing to them.
No, I understand the compulsion of it, but how do you enable and make people comfortable to take digital health solutions, right? The card is still a physical card is what you're talking about, right? Which is linked to a digital database. Now, what I'm asking is slightly different. What I'm asking is, how do you make, let's say my father who is 70 years of age, right, take a digital health solution, right, or enable them to take a digital consultation, right, and make them comfortable while doing it, right? That is not necessarily linked to a health card per se.
Somak, adding a question. So when we were going through digital inclusion for how to ensure digital inclusion for older people, we came across 5 barriers. The first was access, installation, knowledge, design, and trust. The trust part was sorted because we believe that data privacy is in place. And so for access and installation, we thought there will be community centers which are still there. So if you go to Delhi or such places, the Mohalla clinics have something called as helpers. So we thought that there will be a network of community centers which would be not an addition. It would just be leveraging the existing Mohalla clinics and rural clinics in place to ensure that we can run digital literacy programs and then update information on the renewal technology as and when we upgrade.
Got it. Now, specific one more question, right? If you are looking at covering a pan-India base, right? And let's say we are looking at specifically teleconsultations for simplicity's sake, because that's a large chunk. What do you think are the key challenges in terms of adoption, or in terms of adoption from the end user? 2-3 key challenges that you see in terms of adoption of telehealth across rural or across a pan-India level.
See, the first and foremost, as we mentioned, was internet penetration. We have a population expansion of 148% with an internet penetration of less than 25%. And this 25% includes both rural and urban. So the numbers in rural will be very scary. The second thing is transparency. So if education about how digital platforms can be leveraged actually. So if I go to a rural area and ask someone to adopt this particular thing, even for a cheaper rate or for more accessibility, the first they are not sure of the entire end-to-end process, what goes into the pipeline. So they're scared to take the first step. These were the 2 key challenges we came to.
Anything else?
Now, one key challenges was the devices that will be used to monitor them. The smartphones, do they have this particular smartphone? Are we like all the locations in India, are they digitally actually covered? And where they actually live, the demography also plays a very big role in this. People staying on top of mountains, people staying on the coastal areas. So those are key challenges where the coverage will be pretty good.
Got it. No more questions from me.
Just one question. How does the team define what is digital healthcare? Or maybe to rephrase that question, what's your understanding of digital healthcare?
So to answer, digital healthcare could be when I could explain it with an example. Like I'm a person, I'm looking for a solution related to my healthcare. So I could actually physically walk to some place, or could actually look it up with an ease with some smartphone or a device which has an internet connectivity, and could get the solutions to that. So for me, it would be the solution to my healthcare that could actually be provided through digital means could be a building block for digital healthcare.
So I think digital healthcare goes from something as small as the Arogya Setu app we used to an AI-based robotic surgery that goes on, that is in presence. So it actually is very diversified. We need to narrow it down to our geographies and our requirements to come down to problem solution.
Okay, thank you.
Thank you, panelists, for your questions, and thank you, Team 1 and Zeros, for the presentation. Now we will be moving forward with the last problem statement. So COVID-19 vaccines have witnessed a massive surge in hesitancy and conspiracy theories surrounding them, with naysayers ranging from skeptics who doubt their efficacy to even people who have characterized them as dangerous. The movement had originally stemmed from some seemingly reasonable point of concern, such as the complete waiver of liability to companies from being sued for adverse reactions due to their vaccines. The movement has quickly transformed into one that engages in fear-mongering and spreading information through unverified sources. While it may seem easy to discount these people as mere conspiracy theories, the reality is that in contingent is collectively amounting to a larger and larger voice, amplified by the easy spread of unverified information that has been enabled by widespread social media adoption. So, coming to the problem statement, with this context in mind, your objective is to devise new ways or ideate improvements to the existing ways by which government and companies engage in production and sale of COVID-19 vaccines, can increase public trust and improve public messaging and marketing regarding the safety and efficacy of their vaccines. I would invite Team Rosy Nanti to present their solution on the same.
Yeah, can we start?
Yes.
Yeah. So hello everyone. We are here, Team Rosy Nanti, to present our solution to the COVID-19 vaccine hesitancy and the growing PR nightmare about it. So we actually made a statistical analysis to understand why people are not being vaccinated. What are the reasons behind it based on various factors? And considering our analysis, we have designed some promotional strategies that are customized to the people based on their age, locality, education, and income levels. So here's our analysis. It's a snapshot of our entire analysis. So coming to the statistics, 37% of the world's population is still not vaccinated. And the distribution is different among the different countries, as we can see in this figure. So when we went for an in-depth research based on several factors like age, education, locality, and income level, we had some interesting observations. So in India, we can see that the senior citizens are the major chunk of unvaccinated, but in the US, it's different. So the age groups varied when different countries are analyzed. And similarly, the education and income level also played a major role in it. And when the locality factor is considered, interestingly, Tier 1 cities have the highest number of unvaccinated people, followed by Tier 3 and 4 cities and the rural areas. So with these inputs, we have performed an in-depth research using the Likert scales, which will be explained by my teammate Hari.
Thank you, Chinmay. Now that we have seen the various statistics on the COVID vaccination stance around the world, we are targeting the market, like we are categorizing the market basically based on acceptance refusal scale. We have also done a primary research to support our categorization. We can see some of them are willing to take up the vaccinations, and the second category people, they are willing to take some vaccines, but they're concerned about the safety level. And it is also seen that 27% of people, they don't have a proper trust in the government and healthcare system. So that actually triggers and it will actually impact the way they are going to get vaccinated. And we can observe 24% people are waiting to learn how the efficiency of the vaccine is going to be around the surroundings. So that's when he is going to get vaccine. And we can observe that 42% people are getting like just believe blindly like whatever is being shared on the social media, and they completely refuse because of this primary source of medium. And based on the various factors which we have brainstormed and through the secondary data analysis, we have presented everything into this epidemiological triad. It explains everything about environmental, agent, host specific factors. Regarding the patient-provider relationship, there should be a proper relationship and positive interaction between the doctors, pharmacists with the patients. So with regarding to the school students' parents, so like they have to be aware, they have to be told about the possibility of transmission of a virus if the students are not vaccinated. And there are some social barriers. So in order to break them, social responsibility to take up the vaccines, and they have to be appreciated in the society. And coming to the media, there are so many negative reports and so many conspiracy theories which are being shared by anti-vaccination activists. Maybe due to they are just creating some scam, or maybe they would have had some past experiences, really bad past experiences. And especially these rural people where they don't have the proper literacy, they just believe these kind of media conspiracy theories. And even if you see the income level, like even the low level as well as high level economic class, they have some certain level of doubt on safety and questions on the effects of how it is going to be after getting vaccine. And there's also some theory called overloading immunity system. So just because they take so many vaccines in a short span of time, they'll get their body immunity is going to be lessened. So finally, some people have blind belief that natural immunity have lower risk of getting affected by these vaccines, and they just believe that just because they're getting the COVID, they'll have a simple fever, and with the paracetamol they can just vanish the effect of vaccine, effect of COVID. And based on these factors, various countries, government, as well as the pharmaceutical bodies, they have implemented various sportive promotions in the society, and some of them are really important. And my teammate Karthik will be explaining.
So let us see about the solutions part now. Like our prime focus is towards breaking the misconceptions among people. We all know that the problem is shifting towards the demand side from the supply side. Now the supply of vaccines is sufficient, but the people are not turning up. They are more hesitant towards getting vaccinated. So we have found out the factors from the various secondary research and primary research that there are like environmental co-specific factors associated with their hesitancy. So we try to break them. So first we do some campaigns such as Know Your Vaccine and Word of Mouth, where we try to increase the reach of original facts to people about the vaccine and break their myths. This can be done through either digital content and then through testimonials from doctors. These can be done pan-India and also in regional content so that it reaches more people and they become more aware of the true content. Then we plan to introduce a school immunization requirement where the students and teachers are motivated to get vaccinated. They also motivate the parents of students so that they also get vaccinated. Now we have a program called like I'm vaccinated or you. So the key focus of this is to build the credibility by sharing data-driven messages and experiences of vaccinated people. So when vaccinated people share their experiences with the other people, they also tend to come up and get vaccinated.
Hi team, sorry to interrupt you, but your time is up. I will be now opening the floor to questions. Panelists, if you have any questions.
Hey guys. So, quick question. So, what do you think is the current percentage? Are there different reasons in different age groups that people are not getting vaccinated, or is it a common trend that you're seeing? And would want to understand what was the size of the study that was done, that was shown on the first slide.
Yes, sir. So actually, when we speak about the age groups, let's say if we are considering the age group of children like the preteens, so the vaccination of these people are more dependent on the perceptions of the parents. And it's a similar case with the senior citizens, that is especially in the localities of tier 3 and tier 4 cities. But again, when we look at the factors like age and locality combined, the senior citizens are more self-dependent. They are not, their perceptions are not based on their children. So this is where the factors actually differed, and that is why we have separated our solutions to some offline and offline. Like some of the solutions are through digital media, while some are focused on the students and the word of mouth campaigns. And considering the data set, actually I have conducted some secondary research based on the data of various countries. So I actually obtained the relative percentages from different websites for India, US, Germany, Poland, and France.
So what was the size of the primary research that was done?
So actually we didn't get more time to collect enough responses, so it was around 100. So
exactly, we have done around 80 to 85, and it is based on our direct interaction with the people in some rural people, some urban people, as well as some city people. Like we just took.
Quick, slightly unrelated or different question. How many people do you think would be a sizable sample size for a valid inferences on this topic?
So it's there are so many research going on about this, especially this social media. This misinformation sharing. So those researchers are also dependent on the data which they are going to get, because it's widely scattered, and it is not easy to get the insight very directly. So larger the data, the better the insights can be found.
No, the question is, what do you think is a minimum viable sample size for proper inferences?
So to answer that particularly, like we have to drill down into every factor, and suppose in a particular area which is rural, and I'm considering the people having lower income levels and education, at least from an age group of senior citizens or the age group of adults, I need a sample of 500 to actually come to a proper conclusion about the myths they are believing.
Also to add that we have referred some secondary researches that the sample sizes were also similar to like around 600, 700.
And one more thing is, it actually varies depending on the locality. So they have misconceptions around the world.
No, absolutely. That's why I said minimum viable sample size. Right? Not you can go as many as you want. What is the minimum that you think is important? Yeah,
Yes,
no
so minimum would be around 600.
Thank you so much, sir. Any other questions?
I have a question which is regarding to, again, the same question about primary research. See, there are a lot of non-believers of vaccination, right? Could you able to get clear-cut understanding of what are the core reasons why they are against vaccination? And could you do that by different, consumer category or age group or geography or anything of that sort?
Yes, sir. So one primary reason, actually this is for the senior citizens, it is that they are perceiving, they actually don't understand the meaning of efficacy. So if they are termed that the vaccine has 80% efficacy, they are thinking that it will not work properly. What if we are in the 20%, or what if this vaccine has do not have a proper impact on us? So people are just waiting for seeing some results, like after many people trying, let us try after them. that is one reason. And other reason is that they are seeing some side effects. Actually, in the beginning, when the vaccines were released, so there was some news around it, like if people have some kind of medical history of allergies or something as such, they may not prefer these kind of vaccines. So those kind of conceptions are still stuck in people's minds.
So I'll get a different perception here. Vaccine hesitancy is not something very new relating to COVID. It has been existing from very long time. We can see the examples of the vaccine hesitation from smallpox and leprosy. There are some instances where they neglected, they had vaccines, but not up to the mark, like how much vaccine it should be actually done. And later on, again, the disease has prevailed over that area. So neglecting over that is very dangerous.
And there were few herd behavior, like people were trusting these fake news that are spread in social media, and they develop an insecurity towards vaccinations, and that also turned up to be a reason, like people were remain to be unvaccinated.
Now, these are what you're saying is more of one-off experiences or anecdotal. Is there any structured view of what percentage of people believe this versus that? Did you do anything of that sort?
So we don't have that data handy right now.
Fair enough. Okay. I don't have any further questions.
Thank you, sir, for your questions. If we don't have any further questions, I would like to thank Team Rocinante for your presentation. Thank you.
Thank you.
Thank you.
So I think we're done with all the presentations. And now we at MAXI Delhi would like to thank Dr. Sanjeev Varshney for mentoring and guiding us in conducting Mindscapes 2022. Sir, you have truly inspired and pushed us to make this event a success. Dr. Varshney is a professor of marketing at XLRI and has several research papers, books, and publications to his name. Sir, if I could invite you to please say a few words. You're on mute, sir. Sorry, sir, you're on mute.
I hope I'm audible now.
Yes, sir.
Okay. Thank you, MAXI team. Thank you, panelists. I think it was quite an interesting discussion this morning. I think Rolly and others, we started this discussion almost a year ago, where we really thought that probably we can have some discussion on how the health sector has really handled the entire COVID situation and how it has evolved, and what do they typically think how the things would turn out over a period of time. So we have really wanted a very good and a very large session, but I can understand number of COVID waves has really troubled the entire sector to a great extent. In fact, we were planning to have it in the month of January, and the third wave of this event of this COVID happened, and it really didn't work out very well. But today I was very happy to see the kind of presentations, and the panel discussion in particular was amazing, and I think the insights from the three panelists were great. Happy to see Somak there. Somak is, I think, I don't know whether I taught Somak or not. Somak, do you remember me? I don't know.
Absolutely.
Okay. So it was so good to see you here and becoming an expert on this particular topic. And the culmination of this entire program, we thought we really wanted to come out with some kind of a compendium where we can say, we can have a set of case studies where how the entire industry has evolved over a period of time. And if we can really develop that, I think that will be a good addition as a document for the entire industrial sector to look at as to how healthcare sector typically manage the COVID situation, how it has evolved. And probably it might be a learning for generations to come. So that is the ultimate aim and the thought I had in my mind. I would really request the panelists if it is possible, and we can pick it up. If we can come back to you once again and interact with you guys on writing case studies and small articles, I think that will be really great. And I'm sure MAXI team, along with the people who had made presentations, would be really happy to work with you on this particular topic. Thank you very much once again, and I really hope to see a compendium coming out of this entire area. Thank you very much.
Thank you so much, sir. And to all of the panelists who joined us today, thank you so much for making MAXI Delhi's first ever flagship event a success. It was an absolute pleasure hosting you as our esteemed panelists. We would also like to thank you for sharing your views, insights, and providing your valuable feedback to all the participants. I'm sure all of us currently on this call, as well as the participants currently watching this session live on YouTube, have enjoyed this as well as gained knowledge from the session. We are truly honored for hosting you and wish we can only build upon the success of this event in the coming editions as well. To conclude, I would also like to thank our sponsors, our merchandising partner, Elon Markets, our comfort partner, Tiny Explorer, our gourmet partners, The Millennial Kitchen, our gifting partner, The Cosset, our grooming partner, Rubel, our decor partner, Decor Alley, and our education partner, Harish Consulting. Once again, thank you so much, everyone, for joining.